of the Health and Wellbeing Board. So it's lovely to see everybody here, albeit well distanced. So I'm kind of binoculars out to see folk down there. And I apologise if I can't read your name badges from this distance, but I truly can't. You can't probably read mine either. So just so that you are all aware, and before I start, if I can say that our Director of Governance and Assurance is due to join us shortly, just so that you're... Oh, and right on cue, here he is. So that's fine. I don't have to tell you that he's going to be late, because he isn't that late. So if I can just make it clear to everybody that this meeting will be webcast, and a record will be retained on the Council website for up to 2 years. And by participating in this meeting, you are consenting for your name, the content of what you say, and your image to be broadcast and stored on the Council website. And if any of you, whether you're a member, an officer, or a member of the public, have concerns with this, please contact the Committee Services officers straight away. For anyone at home who's viewing the webcast, can I inform you that if you look above the video, you'll see a resources tab. If you select this, and a link to the agenda will appear on the right-hand side, that means you can then open the agenda in a PDF form and you can be able to follow the discussions and debate. If I can remind you that you do need to turn your microphone on, and I'm the worst offender for forgetting that, I should say, when you're speaking. Otherwise, what you say won't be captured on the webcast. And please turn your microphones off when you're not speaking, because otherwise we get feedback. And if I could ask that if members keep their masks on unless they're actually speaking, that would be very, very helpful. And especially considering that we're the Health and Wellbeing Board, I think we should really lead by example. So if we can start on our first item, which is any declarations of interest.
Yeah, thank you, Chair. On the item where we discuss the membership, it is proposed to ask the Constitution and Standards Committee to consider any decision of this body. I'm a member of the Constitution and Standards Committee, and if Mr McCourt would want to give me some advice as to whether I should take part in this item here, my initial view is I cannot make a decision here on our membership that I'm referring to myself as a member of the Constitution and Standards Committee, but I'll happily listen to the official advice on that. Thank you.
Thank you, if I may, Chair. Firstly, apologies for my late arrival and being a bit mentally dishevelled. My colleague who should be sitting here has received notice of self-isolation through track and trace, so I guess you here will appreciate that more than most through an organised socially distanced event she attended on Sunday. In answer to the question, Chair, is what's known as structural bias. So, Councillor Gilchrist, not only are you allowed to wear two hats, you're allowed to have a different opinion wearing both. So please continue.
So on that basis, Chair, I shall remain and, if necessary, take part in the debate when it comes. Thank you.
Any other declarations of interest? Right, thank you. Apologies for absence. Do we have any other than the ones listed here?
Thank you, Chair. Yeah, we've had a couple of extra apologies for absence, so I'll read them all. We've had apologies from Louise Healy, Warren Ward, Councillor Tom Anderson, Nicola Allen and Liz Bishop. And we've also had apologies from Janelle Holmes, with Matthew Swanborough attending as a reserve, and apologies from Sheena Comiskey with Faisal Alam attending as a reserve. Thanks, Chair.
Thank you. Anyone aware of any other apologies? No? Great. Thank you. The minutes of the meeting held on the 31st of March. We approve the accuracy of those minutes. I'm happy to move that if we have a seconder. Anyone who was present
Happy to second, Chair.
Okay, thank you very much. Councillor Clements, have we had any petitions, public questions?
No, Chair, we haven't.
No, okay. Thank you. Which actually brings us on to membership, the first item. And, well, Vicky Shaw, our Head of Legal Services, was due to present the report. I'm assuming that now Mr McCourt will present the report.
I'll do my best, Chair.
Thank you.
So, just by way of introduction, members of the board, the way that Health and Wellbeing Board is set up is the legislation says it is to be treated as an ordinary committee of the council. I'm here to tell you that whilst that says it's ordinary, it's anything but. And is, as you've come to know, it's a bit of a strange hybrid beast, and the only place where, for example, officers of the council who are servants of the council actually get a vote as though they were an elected member in exercising their professional role. So this board has a very particular purpose and is set up in a very particular way, as you know better than I, to bring people of different organisations together to put together that strategic needs assessment and carry out as many associated roles as you feel is necessary excuse me, in order to bring you together to go about your work. The changes that have happened, as you're aware, is that the council has moved into a committee system, and of course Health and Wellbeing Boards were set up with leader or directly elected mayoral models in mind, so there's a little bit of tinkering to be done. And over and above that, you, I don't need to tell you, you've got the integrated care system coming down the tracks and the asks within the prospective legislation from the white paper for this Health and Wellbeing Board to be a centre of that place discussion as that comes to fruition next year, and we follow the legislation that was put forward in the Queen's speech as we go through the year. So there is that opportunity for you as a Health and Wellbeing Board to review your membership and whether it's currently set up in the right way, but also to make a marker to say, well, actually, as things develop over the year, you may wish to tinker with it further. So it was worth reminding you all of the essential membership as laid down in the legislation, the core membership, voting membership as currently laid out in our constitution, and then the additional membership and your ability to co-opt further members that you feel is necessary to get the work done. So this is a bit of a placeholder for you to have that discussion and remind yourselves that you will need to keep looking at this. Thank you, Chair.
Right. Thank you for that, Mr McCourt. Any comments, questions on the whole issue of membership? Graham, yeah.
I think clearly the membership as reflected in the paper, Chair, is the current membership, and there are some aspects of that which are historic. So, for example, it does refer to 3 divisions of the CCG. So the membership is subject for review. It does need to be reviewed, I believe, in order to enable that to be fit for the Health and Wellbeing Board's role as the board for place. And I do think that does then mean that we need to look at whether the membership is inclusive enough to really fulfil that role.
Thanks for that, Graham. Any other comments? Certainly, one of the things that occurred to me, I think it's important that we include as many of our partners as we can on the board, and I wonder whether one of the things we could consider, for example, would be the chairs of our key, because I noticed that the chairs of our key health partners are not included, for example, on the board. So I think there's quite a few others. One of the other appointments or co-options that I thought would be really helpful would be, for example, the principal of Wirral Met College, because we are looking overall at health and wellbeing in its widest possible sense. So any other areas that people think may be useful to consider, because we will need to take something into standards for them to ratify. Any other suggestions? Any other ideas? Councillor Gilchrist.
Might I ask, Chair, at the meeting we had in March, David Eva attended on behalf of Healthy Wirral Partnerships. How is that reflected, or might be reflected, in our membership, if we're regrouping and inviting people?
Thanks. I mean, I would have thought that that would be reflected by making our membership here more inclusive, to include a lot of the people who are on the Healthy Wirral Partnership, because he's an independent chair as opposed to being the chairs of one of our key partners. So that was one of the reasons I suggested the chairs of our partners were maybe invited. Would seem to be a solution to that, I would have thought. But good suggestion, thank you. Anything else? Okay. So we'll perhaps pull together a further report to go to Standards Committee and look at any other proposals. Thank you. Do I have a mover and a seconder for? Oh, sorry.
Sorry, it's a little difficult sitting in.
It is.
I'll
No,
have
it's
to
all
learn
right.
to
I kept doing
waft better.
I kept doing that to Councillor Jordan's.
I was going to suggest, as this is an unusual committee of the council, and as it's really important, I know, to everybody sitting around the room, that we have voices from children, young people, members of the community out there, that we have a nominated place, even if we don't have a representative that actually comes, to suggest that somebody could come and attend each board from a different group in order to bring that voice on that theme.
Yeah, I think that's really, really helpful. And in fact, one of the proposals we had on the original membership list, I think, from our first meeting, or the ideas for membership, was that we had a representative from the Children and Young People's Partnership on the board, because I think that's really important. And the other option was for there to be a Children and Young People's reference group, in the same way as we've developed a reference group for the community, voluntary and faith sector, because it's too wide and too diverse to have just one person on the board. So I think that's certainly maybe something that someone you could take away and consult with the children and young people and ask how they would like their voices to be represented on the board. And we'll.
Thank you, Chair. We certainly will. And as I say, we could have that notional placeholder which could go over children's and adults, depending on the themes at the board, to make sure we can bring that voice in.
Recommendations are that we note the Health and Wellbeing Board's current membership. Okay. We elect any individuals for co-option, and that we recommend that reference to the 3 divisions of the NHS Clinical Commissioning Group. I can't remember how long ago it was they disappeared, but that's removed. And that any further amendments will be considered by the standards. That all sounds very sort of complex, but unfortunately, because it is a committee of the local authority, that's the way it has to be. Nothing is straightforward. So do I have a mover and a seconder for those recommendations? Can officers remember that they're also members of this committee? Yes. Councillor Williamson, thank you. Thank you. So you all forget that you're not used to being voting members of the committee, clearly. Right. So that then brings us to item 6, which is the integrated care system update. And that is our Director of Care and Health is going to present that report.
Thank you, Chair. This paper setting out the proposed strategic changes in the NHS and implications of those changes for us as a place, as a borough, it really is intended to give a top-level overview of what's expected nationally and what can be defined locally. It follows on from the report at the last Health and Wellbeing Board, which really was a set of slides. This paper was also in a very similar form delivered to the Adult Social Care and Public Health Committee of the Council. It is intended to be very high level and really just to set out some overall principles that have been agreed across the system, and really to share with the Health and Wellbeing Board how we are looking to develop the programme of work to support the development of our integrated care partnership in the light of those evolving arrangements for the integrated care system. So the report focuses on the initial programme arrangements. They are clearly subject to review, and how we work together across the whole system is evolving as we move forwards. Future reports will also need to come to each Health and Wellbeing Board, really setting out how the programme of work is progressing and the key elements of the integrated care partnership underneath the Health and Wellbeing Board. The idea is that the programme really will bring together each of the key aspects of the integrated care partnership, which in elements is three elements, 3 pillars. The Health and Wellbeing Board, and the Health and Wellbeing Board is emerging as the strategic place partnership for Wirral. The work in relation to provider collaborative, which is key to how providers work together across the borough to deliver the best outcomes for our residents, and the role of the Strategic Integrated Commissioner as the third element. So 3 key elements to the programme, which does involve working together right across the whole system, and will evolve as we understand more about the integrated care system and how the integrated care system will interact with our local integrated care partnership. Thank you, Chair.
And then Councillor Williamson.
Thank you, Chair. I have some trouble hearing everyone, but you'll forgive me. If I put my hearing aid in and pull up my mask, so to speak, I pull my hearing aid out. So I get to the stage of managing without hearing aid, but it's very difficult. In the plans on page 18, Chair, there is a note that says there should be produce a communication plan. And I appreciate that it's not easy to set out concisely as we might like, or clearly as we might like, exactly what this is all about. Some members of the council get communications from people who are very sceptical about this change, and the only way to answer them properly is to be very clear about what we want, which is as much power as possible in our local hands, and a good exchange of views with the structure that's emerging for Cheshire and Merseyside above us, good exchange of views about what they might be doing and what we want to do, so that everyone knows what's going on. So in terms of every time we meet or we consider this report, it'd be very helpful if our officers could work with you to issue a comment about the progress that's being made. In many respects, I'm going back 40 years when we had something called the Mersey Regional Health Authority that used to be in Pall Mall. And in those days, that was followed by 3 primary care trusts in Wirral, that then became 2 and then became 1. And at each stage, there have been big structural changes that the members of the public, who may not follow these things in such detail, don't have the time or opportunity to actually find out what it's all about, when the key issue for us is making lives better for people and coordinating health services, and that's our key focus. So if it's possible, as a result of each of these reports, to produce a statement saying where we're up to, that would be very helpful. I know that councillors get a regular bulletin from the people leading the Cheshire Merseyside organisation, which keeps us up to date, but translating that and explaining it to the people who may attend the doctor's surgery or may be worried about their health conditions, that's the key message, that we're trying to improve things for people and that some suspicions may be unfounded.
Thank you, Councillor Gilchrist. Councillor Williamson.
Thanks, Chair. And mine was along the same lines, really, as Councillor Gilchrist. That there is a lot of noise around this. This is huge in terms of impact for people on Wirral and for service users. Sorry. So you should start again.
Sorry, Chair, I wasn't trying to come in.
Okay, I'll start again because everyone was like looking down the room. So, yeah, it was just to along the same lines as Councillor Gilchrist. The integrated care system is huge. It's the biggest thing that I can remember as a councillor, and I feel that this obviously is the place where most engagement will take place. But I don't think it should be limited to this committee. We have a lot of correspondence. I've talked to a lot of residents about this who are very concerned too. I think it's we have a duty to get the narrative out there, and I don't mean that as a spin narrative. I mean, can you explain to people what this actually is and what the impact is? Because I know there's a lot of scaremongering, and we'll have to unravel that, won't we, and unpick that. But I do believe that there's grounds for the concern that's taken place around these changes. So I make a plea as well that we can have wider engagement with councillors who aren't on this board and with residents. Thanks.
Thank you, Councillor Williamson. It is really important that people know what's going on, but of course at this point in time the primary communication has been the Queen's speech. The NHS nationally is developing this piece of work, and a lot of what we're doing locally at the moment is attempting to interpret what's happening nationally and to understand as the legislation emerges what it means for us. So there is an issue in relation to timing of communications with the public, because clearly we can tell them what's been decided and agreed at the relevant points in time. We could tell them now we've got a project to respond, but there's not a lot more than we can say at this very point in time in terms of the specifics of the legislation. But I do think the point will come in the very near future where that communication can be extended.
I think to follow that through, I suppose death taxes and NHS reorganisation are 3 givens in public life, and this structural change is not about recreating health authorities. It's about creating a partnership in which each place has a role to play within that. So hence the creation of a partnership body for the integrated care system, as well as an ICS NHS governing body, which will also have local authority representation on. And the driver is more about integration and is continuing about making people's lives better. I'm hoping that the changes people will see will be positive through improved working. And I think we've got really good examples of that in Wirral already, of the last couple of years, in terms of how we've worked together as a system to improve people's lives. But I would hope that the structural changes themselves, which are largely around where functions are delivered from, the public shouldn't see too much impact upon them. Graham's right in terms of the guidance on this is very emergent. We've had the Integrating Care Next Steps document last November, which reaffirmed the intent set out in 5-year forward view and the NHS long-term plan to create these approaches. We've had further planning guidance which indicates that there will be certain things that integrated care systems will have to put in place, but how they interact with each borough, each local authority area, will be down for those areas to have a discussion and agree with them. And also, as Graham said, we are expecting some further guidance this week in terms of design frameworks and how these structures are going to emerge, which we will need to respond to in terms of the development of our integrated care partnership. But there's very little clarity that can come at this stage until second reading, because if not, you're preempting the will of Parliament. And there's very little that can be appointed formally until after the bill receives royal assent, and therefore it becomes a legal matter. So we are committed to sharing as much information as and when it arrives, both with the Health and Wellbeing Board, but also there's 3 papers I've done to Partnerships Committee over the last 6 months, another one going on the 29th of June, which Paul Edwards will be presenting on my behalf as I'm on leave. And I believe that will lead to a call from the Council in terms of a scrutiny role across Cheshire and Merseyside. I believe that's being proposed. So actually, again, there is political scrutiny of the proposed changes as well. But we are absolutely committed as we develop this project to bring updates to you from both the elements of integrated commissioning, the further development of provider partnerships and alliances, but also how governance will work within the Health and Wellbeing Board, kind of being the apex of some partnership working between the NHS and local authorities and others in our system as well.
Thanks, Chair. I suppose I agree with what Graham and Simon has said, and we've been working very much in an integrated way for a number of years now. And I think if we look back over the last 15 months, the way we have come together across Wirral to deliver health and care in the most difficult times that we've ever experienced in NHS history shows that we have a great maturity and ability to work as a system. And we can tell you all about the bill and where it's going through Parliament and all of that. But actually, what I'd like to know is, what are the concerns that you're hearing from your constituents? And how do we address those concerns? Because we can go out with design frameworks and we can go out with all of the NHS, I don't want to use the word jargon because that's inappropriate, but we can update on all of the guidance that we're getting as it's coming in a piecemeal fashion. But actually, what I'd like to know is, what are the key concerns that you're hearing from your constituents? Because it may not be about what the system's going to look like in an integrated fashion. It may be, can I go to my doctor and be seen? And how is that going to change in the future? Or what's going to happen to my appointment in Wirral hospitals or with the district nurse or in CWP? And I think if we can get to that, to understand what our residents' concerns are, because that's what we're here for. We're here to deliver health and care to the 337,000 people in Wirral. And we do that to the best of our ability. And if we remember the individuals, then we can't go far wrong. So if you could share that with us, then we can develop communications around that in a way that's speaking to what the concerns are, but also keeping abreast of the changes as they happen.
Thanks, Joe. Excuse me, sorry, mine was probably the same as Paula's. We haven't heard anything about the integrated care systems and things like that from the public, but we have heard about access to GPs and access to hospital care. So I think it's something that would have to be really specific to go out and say, what do you think about integrated care systems? Because it would only be a certain audience that would ask those questions, I think. But I do think, just reading through some of the documents here, one of the big things that would help most members of the public would be a glossary of terms, because I struggled with ICP, ICS, HCP, NHSA, NHSI. You know, I think there needs to be a little bit more thought about how those documents are put together. Thank you.
Thanks. I think particularly those last two contributions are really, really relevant to what both of the councillors have said, and it is those things that people worry about, and particularly when, you know, there are a lot of concerns. They're well-founded, many of the concerns, and there is a growing campaign being waged. So people are being given information which is telling them they'll have to pay to see their doctors, or they'll only be able to look at an app, they won't be able to see a real person, all of these things. And, you know, so people will be getting very, very concerned about that. So we need to get as much information out there as we can. Councillor Williamson, then Councillor Gilchrist.
I mean, thank you for that, and that was reassuring. I was just trying to, I suppose, articulate that something as fundamental as this. It's the politicians who are the people that get the inquiries, the concerns, the anger, the worries. Specifics, I agree. This is, but I've heard, you know, people will have to start to pay for routine treatments that are currently free. They won't get an appointment with doctors. This is the first road to privatisation. It'll be an insurance-based health system. I appreciate what you said about that comes from a certain segment of the population. However, that specific segment direct all of that towards us, and we have to then go back and try and explain away, or sorry, not explain away, but explain and answer those concerns. So I guess it's a plea to bridge that gap between healthcare professionals and politicians. So we're all kind of there helping our residents get to grips with this. And I think, you know, look, any perceived or real attack on the NHS is always met with sort of, you know, a real strong reaction from most residents. And whether that's accurate in this case or not, that's how it's playing out in some parts of the borough. So my concern and plea as a politician would be that let's get a concerted and joint effort with us all to address that. And I appreciate your responses. I do. Thank you.
Yeah, thank you, Chair. I'm grateful that Simon and Paula have given us a lot of reassurance. I have circulated the material that I received the other day to certain officers for them to be aware of what's being said. I think, as Councillor Williamson says, there are residents who feel the whole process is a Trojan horse for something else that might happen. I'm grateful for all the reassurance we've had, because of course with the pandemic and its results, what residents are interested in is the access to doctors and the way the NHS is going to work around the clock, effectively to catch up with the backlog of all the treatments that haven't been able to be done. And that's what people are interested in, of course. Might I suggest, Chair, that in addition to noting the report, that once the legislation is introduced in Parliament, the board is alerted to its content and especially any departure from the principles and aims set out to date.
Thank you. We have met, but just in case you can't figure me out behind the screen, it's Karen Howland, the Chief Exec of the Community Health and Care Trust. I just want to pick up the issue of communication, because it is terribly important, and the vast majority of my staff are mobilised across the geography of Wirral. And we do employ a significant number of people, and we use them to actually communicate with local people as well, because local people are genuinely concerned, aren't they? And the offer really is, and I'm sure this offer is extended across the colleagues to my left and right, that we would be very, very happy to receive those concerns in whatever format the council wishes to give us those, and help the council deal with those concerns, because it's quite right. local people are not interested about what we're doing with our organisations and configurations. What they are concerned about is access to services and will they be supported, and what about granny down the street, etc. And we can deal with those issues very, very quickly. So the offer really is that as soon as we know about it, we can help deal with some of those issues. But most of us also use our workforces because we're big employers across Wirral. So we can use our workforces to calm people, deal with their queries. I know an awful lot of our social care workers and district nurses, health visitors do actually attempt to deal with any anxiety in the person's home or wherever they are calling home. And that deals with it nice and promptly because they're trusted professionals. So please just let us know and we'll do our best to help.
Thank you, Chair. Listen to what everybody has had to say, and obviously all very relevant points. Just to give some assurance that there is, as you can imagine, it's really complex. There's an awful lot of work to do. There's still a lot of things to be defined. There is a detailed programme plan that at this stage is the local authority and the major NHS trusts are working collaboratively to establish, which will include a detailed communication plan on all sides of what we've spoken about and how we deal with some of the challenges, not least around engagement with the third parties, the third sector, the police, all our stakeholders around this table, because this has an impact, if done right, to have really positive benefits for the borough to deal with some of the challenges we faced for a number of years. So to give some reassurance that this is evolving, but there is governance and structure behind it, and would welcome the opportunity to share that over the coming months through this forum. But we are interpreting it as we speak as much as everybody else. But the view that ultimately one of the things we do recognise we've got to do is actually, if you like, set out what the end state looks like, so that the residents, patients, everybody because that's why we're doing it. That's why the reconfiguration is happening, is for the benefit of for the general population. So we need to get that story right.
No further comments from anyone? Questions? No, nothing else. Thank you all very much for your contributions on that one, and thank you, Graham, for the report. I think it is very telling talking about what Councillor Williamson talked about, the link between medical professionals and health professionals generally and politicians. It's one of the things that this board can provide. And links between health professionals, politicians and our community-based partners as well. Whether that's the police, whether it's Jobs Centre Plus, whether it's the Community and Voluntary Sector, wherever, all of those people in the community. Picking up, I think, a very helpful point there made by Karen from about the workforce. I think, though, when we do come to look at, and we are working on communications strategies, which are going to be absolutely vital, I agree, couldn't agree more. I think our workforce has to be one of the key audiences for those communications, because there will be concerns amongst the workforce. What's this reorganisation? What does it mean? What does it mean for me? Where am I going to be working? Am I going to be working in a different place? Is it going to be a different team? What will it look like? So it's just as important that we're communicating well with our workforces in whatever sector that is. So there is, as the Chief Executive says, a huge amount of work to be done, and this board, because it is writ large into the plans of how this will go forward, both plans locally, regionally and nationally. Health and Wellbeing Boards are a vital part of how we take this forward. So there will be continual updates, and I think it will be important that we undertake not only to bring regular reports back to committees, but also I think to make a commitment that key information that comes out between committees will be circulated to all members. So I'm happy to give that commitment on behalf of the officers concerned that will happen. On that basis, then, can I have a mover and seconder to just note that report at this point? There's not a lot else we can do with it, but we need to note it. Thank you, Councillor Williamson. Seconder? Yeah. I've got a seconder. Thank you, Paul. Okay. This then moves us on to some of our other reports, and we've got some really, really interesting reports to this meeting, all of which I'm really pleased to see, because these reports all begin to demonstrate how, as a partnership, as working together, we can begin to bring alive the aims and the objectives of this board, all the different aspects and the way we can see through, whether it's through commissioning, whether it's through regeneration, whether it's through prevention, all the different ways in which all of us, in our own different ways and the own different ways that we're working, can achieve the objectives of this board. So I'm really pleased about this range of reports we've got coming this afternoon. So if we can start with the commissioning plan, Jason.
Thank you, Chair. So this report introduces the Wirral Health and Care Commissioning Draft Single Business Plan for 2021-22. The key priorities for our work within Wirral Health and Care Commissioning are set out within the plan, and the plan is attached to the report as Appendix 1. Health and Wellbeing Board members are asked to note the content of the report and the priorities within it. Wirral Health and Care Commissioning jointly commissions all-age health and care services across a whole range of services and need for the population of Wirral to improve people's lives. The purpose of Wirral Health and Care Commissioning is set out within the single business plan at 1.1, and it's to improve the health of local communities, listening to the views of local people, caring for people in the long term, and getting the most out of what we have to spend as a system, and working as one, acting as one with all of our partners. That's the main purpose as set out in the single business plan. Our vision as a partnership is set out in section 1.2, and it's to enable all residents of Wirral to live longer, healthier lives by taking simple steps of their own to improve their health and well-being, and to provide the very best health and social care services when people really do need them, and also to provide services as close to home as possible. Really important, and it underpins the principle of home first that we work to across the system. The priorities are set out in the next section of the plan at 1.3, and there's a short list of them which I'll just go through to highlight for board members. They are to improve health and wellbeing outcomes, to reduce health inequalities, very importantly, and that features very prominently in our single business plan. Enhancing productivity to get the very best we can for our residents. Providing oversight and leadership of the care and health system, linking to the discussions we've had around the future direction of the health and care system. To manage the care and health market. Market management is certainly a duty of the council, and we take an overall role in managing the care and health market. To enable and support the provider collaborative, we work very closely with our provider organisations in Wirral, and all of the discussions that we have with them have informed our single business plan and our priorities. And supporting social and economic development and Wirral as a place. Section 2 of the business plan sets out some of the background information linking to the Joint Strategic Needs Assessment and some of the data that will be familiar to many of us. It also sets out the future direction of Wirral Health and Care Commissioning and the wider health and care system, and links to previous items on the agenda today. Section 3 goes on to describe our priorities in more detail. There's a strong focus on reducing health inequalities. That's really important to us as we embark on all of this work for this year. Figure 2 is a diagrammatic illustration of the health inequalities and the priority work that we plan to undertake. What I'd like to finish by saying is that person-centred care underpins everything within the plan. Everything that we do should focus around the person, what's important to them, what they need at the time they need support. So person-centred care is very strong in the plan and features within all of the work streams. So members are asked to note the content of the single business plan and the priorities within it. And happy to take any comments or feedback on the single business plan, Chair.
Thanks very much, Jason. Certainly that report was very thorough and very informative, so thanks for that. Any comments, questions for Jason on that report? Councillor Gilchrist.
You'll forgive me, Chair, asking about one particular detail which I may be totally misinterpreted, which may be me, because I often do that, and then people put me right. So I'm quite happy to be put right if I'm wrong. I'm asking about page 38, if I may. It's in the list of children's and families' priorities. It's a number of bullet points down, about the 12th one down. It says, every pregnant woman within the maternity service has a personalised care and support plan, sonography team, to provide all pregnant women with brief interventions, bringing together all women's services into a central hub, including birthing facilities, antenatal classes, and expanding the support offered through body systems and creative therapies. The bit that leapt out at me, so I don't want to misunderstand it, is this issue of the central hub. We had much discussion about facilities in Seacombe a year or so ago, and I don't want to misinterpret what I'm reading here, that there may be, say, central coordination and local services coordinated in particular areas or the primary care networks. But I just wanted to be clear what this actually means in this section. And I'm looking at Jason to see if he can help me. Thank you, Chair.
Thank you, Councillor Gilchrist. I may need to come back to you with some detail around that because I personally can't respond at the moment, if that's okay.
So, Councillor Gill, this comes out of the publication Better Births a few years ago, which was aimed at improving the experience of women and children in terms of the maternity pathway. Hubs also have spokes, so on the Wirral we have a very good antenatal and maternity service being provided across the piece. And as you highlighted, Seacombe is one of those spokes from that, which allows women to have a choice of birth in a more home-like environment. Part of the drive around Better Births was to offer women a choice of place of birth, as opposed to an obstetrician-led delivery in a maternity hospital. So, as a minimum, a woman will get a choice of an obstetric-led birth, so it's a hospital based under a doctor, effectively, a midwife-led delivery in a hospital setting or midwife-led unit, or a home birth or something like that has been developed in Seacombe, which is a home-like environment, all of which have demonstrable better outcomes. So it's part of a bundle and it's not about the centralisation of services at all.
Any other questions, comments for Jason? No. In which case then, can we note that report? Happy to move that. Councillor Williamson, second. Okay, thank you. that takes us to prevention. Elizabeth, thank you.
Thank you, Chair. Good afternoon, everyone. My first report this afternoon is on prevention and is presented to the Health and Wellbeing Board for noting. If I can start with the policy statements and the prevention framework. The intention of the policy statements is for the Council to make a clear commitment to early intervention and prevention across its services. The case for early intervention is supported across the Council, and this policy statement clearly sets out our intention, the national and local context, the benefits, and our commitment to the approach. Underneath the policy statement is the prevention framework, which has been developed with internal and external partners, and it seeks to provide anyone working in public services with a structure and guidance on taking a preventative approach. The framework defines prevention and the different levels, whether primary, secondary or tertiary prevention, and it details the foundations that were agreed by the partners. The framework also details the underpinning values and prompts public services to think about how they can create more opportunities for preventative work. It is intended that over time we will create a suite of preventative programmes that sit underneath the prevention framework. The Break in the Cycle programme, for which you have the prospectus in your packs today, is the second part of this item and a really good example of a preventative programme in action. It seeks to work with people from the priority wards in Wirral who are facing multiple disadvantage. So that includes substance and alcohol misuse, domestic abuse, poor mental health, risk of homelessness, and involvement with the criminal justice system. As detailed in the prospectus, there are 4 key elements to the programme. The first is that participants will be given priority access to one of our Catalyst programmes, of which we have 8. Members today will be aware of a number of those programmes, I imagine, whether it's the Family Nurse Partnership, Drive, the ADDA programme, Cradle to Career, etc. So these are specialist interventions designed to work with people who are facing these kind of issues. In addition to that, participants will benefit from what we're calling adapted practice. This is something we're working cross-council to develop and really test out, where we are asking partners from across the organisation to work differently, to adapt what they do in their daily practice to better suit and work with this cohort of people. Within your report, you'll see we're referring to something that we call a bit more. And this is where we're asking for these participants to really benefit from a bit more time, a bit more support, a bit more one-to-one help, a bit more compassion and empathy. So we're working cross-council with colleagues to ensure that across the different departments together we can work differently with this cohort of Wirral residents. The third element is to benefit from a trusted relationship. There's been a lot of research recently around trusted relationships. This moves us beyond the coordinating and navigating role to really establishing a relationship where the workers understand the daily lived experience of the child, the young person, the adult, the family, and their wider networks. The final element of the programme is around improving partnership collaboration, which has quite a specific focus on data transformation, sharing information, and using that information smartly to provide the best services. But also we seek to understand which interventions have the biggest impact, or combinations of interventions work best for different people. The report also provides a theory of change model and an outcomes plan, which gives more detail on the types of changes we want to achieve with our Wirral residents. Happy to take any feedback, comments or questions. Thank you, Chair.
Thanks very much, Elizabeth. That fascinating report. Really, really interesting programme. So I think has got huge implications for what we do and absolutely vital for this board. Any comments? Councillor Williamson.
Just to echo that, really, thank you so much for all your work on this. I think to the layperson, this is so obvious and fundamental, isn't it? You know, there are huge inequalities in the borough. And one of the telling sentences in this report was that health inequalities are preventable. And yet we have them, and we have had them for so long, that I think there's a feeling that there's some kind of inevitability, and there isn't. And the key to it all is precisely in this report. It's about prevention and about working with our residents to give them the building blocks for them to have a good standard of living that addresses mental and physical well-being as well as their economic well-being. As part of the combined authority, I was looking at the work of FASJAB, which is Fairness and Social Justice Advisory Board, who were very keen to work with us as a council on the prevention agenda. So that would be something I could speak to the chair about and yourself. But well done. This is just something that I think is so vital in our agenda of tackling inequalities. It's got to be prevention. When it gets to the point that the inequality is rife and systemic, then it's too late in some respects. It's got to be prevention. So thank you very much.
Yeah, thanks, Chair. Thanks so much for this. It's excellent, really excellent piece of work, and really hugely supportive of it. I'm really passionate about tackling health and care inequalities, and I chair our System Inequalities Group. And I think your colleague, do you work with Keelan Early? Yeah, he comes to the group and talking about the Cradle to Career project and all the work that's happening around in the north end of Birkenhead area. But I've said to him a few times, it's not just about one particular area in Birkenhead. We've got, when we look at the IMD maps, we look at those areas of deprivation across Wirral, and it's about tackling those health and care inequalities. But really what's coming out in this and what we're trying to address through the inequalities group, that, you know, our cross-system inequalities group, is the issue of the wider determinants. It's not just about a clinical presentation. It's about what's underlying that and what's underpinning that. And our children are the adults of the future. And it's about how can we support them, particularly in light of the COVID pandemic and the impact that COVID has had, that COVID has had on parental mental health, and then the knock-on effect onto our children and their mental health, and how they have coped through the COVID pandemic. And there's a lot of work being done around the silence to violence issue, where children see a lot, but they're internalizing it, and then it starts to come out in antisocial behaviour as they grow. So really happy to link with you outside of here, because the work that's in this is really powerful. Thanks.
Thank you, Chair. I think this is a really important report, and it's a very well-written report. But I do think the context is broader, because I think we're here today as a system, Health and Wellbeing Board system, and I think that what we're looking for really is a system approach to early intervention and prevention. It goes all the way from what happens at a very local neighbourhood level alongside primary care networks, unlocking the potential of working at a very localised level to intervene early. And we've had some really good evidence over time about how low-level interventions can really make a significant difference at that level, right through to what we do here as a system partnership. So I think that everything you've said in this report is endorsed, but actually it's for all of us as a full partnership, as opposed to for the council alone across its various directorates to do this. And I think that for me, that's how we get the very best from this approach. Thank you.
Thank you, Chair, and thanks, Elizabeth. For me, page 64 talks about the 3 distinct levels of prevention, and really it's building on Graham's point, and I think a conversation that we all started earlier this year with last year. I've lost a year of my life. The conversation we started with the Local Government Association about the Health and Wellbeing Board, and the fact that the members wanted to very much look at the wider determinants of health all the way through. So I think we talk on page 64 in the report around primary, secondary and tertiary prevention. And I think it's important that we keep those definitions in our heads to actually then be able to help us shape our programme going forward. And the fact that Alan Evans is sitting at the table, I think, is really important, because I don't think our link to the regeneration agenda as a board has been as strong as it needs to be. And so the fact that we've got Alan here now and we've got this massive, exciting regeneration programme in the borough, it's really important that those links are made alongside the important links that we've talked about this afternoon with the health sector. Just as a bit of a, I suppose, an advert for coming meetings, we will be bringing the Public Health Annual Report in September, which will be looking back at what's happened to us as a borough over the past 18 months and talking about work to tackle health inequalities. So I think this is an exciting part of our work programme going forward about how we bring all the different elements together. But really endorse this work, and it's great finally to see the ADA programme, Family Nurse Partnership, all those programmes coming together in the round. Thank you.
Thank you. I love this report, actually. I think it's a fantastic, fantastic start. I think my only comment is we need to invest more. So I think we need to be more ambitious in investing in prevention, because I think anytime you invest more in prevention, evaluation, and research, you will actually get the benefit significantly more later on. So from my point of view, we need to be more ambitious, and I fully endorse everything you do. And I also agree in terms of the system approach is very, very important. Thanks.
Thank you, Chair. Not dissimilar. I totally endorse this report, and I welcome it. As you know, we do provide the 0 to 19 services for local Wirral people. But as a result of working with through that contract, we've got bolt-on pieces of work that in themselves have been incredibly rewarding. So we've been working with local schools in Birkenhead pre-COVID. But actually, what started out to be a very small project around aspirations and life chances turned into something quite significant. And Paul is right. We need to ensure that whilst we're looking at the child and the needs of the child and prevention, we do need to always factor in the needs of the parents. Very often, if you deal with that, the rest will follow. So it's a fabulous report. Thank you very much. I do support and endorse it, but agree it needs to be widened out into the system. But welcome it very much. Thank you.
Thank you, Chair, and thank you for all your comments, and thank Elizabeth for a lot of the hard work that has gone on to produce this report. I think what we'd say is we very much recognised in the presentation of the report today it was children-centric, because that's where the work has begun. But for us, one of the key things that will really make this happen is the adopting of the principles within the report. We're very clear that children live in families, that adults are involved, that at every point of that lifestyle cycle, that support needs to be there. And everything we do, even from the major interventions in people's lives to that very gentle, on-the-edge support, can be done in this manner in a way that improves what we do. It improves the life chances of those we work with, but it also makes it cheaper at the higher end, if we're very honest. And that gives us that cycle that we're looking for, that ability to reinvest the money that we've saved into further prevention, both to improve people's lives and to improve our costs. So for me, it's a real win-win, but we would very much like to go on and produce the next set of documents in the not too distant future, which look at the other elements of work that are out there and capture how this would look for adults, how this perhaps look for regeneration, how this would look at some of the other council services and health services across the economy in a preventative manner. And if we do that and capture it in the same way, it'll be really interesting to see what it looks like. Thank you, Chair.
Thank Thank you for that, and thank you so much, Elizabeth. That was a really, really interesting and very, very significant report and piece of work. I think from round the table, I am I'm hearing plenty of people who would be quite prepared to work alongside you in a much wider, system-wide piece of work, so that maybe future reports can be much wider. I'm certainly hearing a fair degree of enthusiasm around the table for this approach. So hopefully we can utilise that and build on it, because that is one of the main focuses of this board. All of those things will very much work towards us achieving our objectives. And now, so we're just being asked again to note this report, which I'm happy to move. Councillor Clements, thank you. Which it's you again, Elizabeth, talking about the youth offer.
Thank you. Yeah, my second report this afternoon is on the youth offer. Again, it's been presented to the Health and Wellbeing Board for noting today. So there's a number of people around the table today that will already be aware of the youth offer. It's almost 2 years to the day since we started this piece of work back in the summer of 2019. And I'll just give you a very brief potted history, because I'm kind of bringing you the last chapter today. So 2 years ago, we started with a consultation with young people about what they wanted to tell us in terms of what would make Wirral an amazing place for them. There was almost 3,000 young people took part in that, and we produced a report called Care More About Us, which is available via the Wirral website for those interested. It's a great piece of voice work that kind of shows their daily lived experiences and their ambitions and hopes. We used that report to pull together a set of recommendations that young people worked with us on, which were presented to Cabinet in February 2020. At that point, 4 of the recommendations were approved, and we've made quite a considerable amount of progress against those. And the 5th aspect, which we were asked to do a little bit more thinking and a bit more work on, was the universal youth provision, which is what's detailed in the report for you today. So the report details the proposals for the universal open access provision for a local, branded and equitable offer for young people across the borough. We will be using a neighbourhood model and a mixed economy of local authority and third sector community-based provision. So each neighbourhood will have a designated venue for delivery and for coordination of the youth offer, a full-time qualified neighbourhood youth worker, which is a really key role. This is the person who will get to know their local community, know their schools, know the community organisations, businesses, partners, different services in the area, and really be a bit of a linchpin to tie those together for young people. Each neighbourhood will have 3 weekly youth club sessions, each for 3 hours. They will get coordinated access to and support from the detached youth work team. There'll be 6 weekly hours of counselling provision provided and a monthly Wirral Youth Weekenders event. The report also outlines the role that the Hive and other community organisations will have working with us to deliver this offer for our young people. We really hope to improve our performance reporting. Previously, a lot of our reporting and performance has just been counting footfall numbers in, activities delivered. We want to become a bit more sophisticated now, and we have got a key set of performance indicators which are in the report for you, and these are things that we think we'll be able to link directly to the youth offer and the impact it's having. So just as a couple of quick examples, antisocial behaviour that involves young people in the area, school attendance and fixed term exclusions, etc. So that key performance indicator set will really help the neighbourhood youth worker and their partners to look at what are the priorities and how can they use the resources best in each of those neighbourhoods. At the Children, Young People's and Education Committee last night, we got approval to implement this under the delegated authority of the Director of Children's Services. So we will be going ahead and establishing the service level agreement with the Hive, progressing with the Wirral Youth Weekenders initiative, and bringing this model to life. And we're really pleased because the timing is important with the impacts of the COVID-19 pandemic on young people, their mental health, their fears and concerns about the future. So we're really pleased to be able to take this into its final stage of delivery. Happy to take any questions or feedback.
Thanks very much, Elizabeth. Any questions? Dr. Cowan, and then Karen, and then Simon.
I'm sorry if I'm hugging the questions. I'm really apologise. Again, great paper. Just wondering, you said you're basing it on the neighbourhood model. Have you been able to link with the primary care networks and the clinical directors within each of the primary care networks? And the second question was, within each primary care network, there are social prescribers. So I was just wondering, had you linked with the PCNCDs and the social prescribers? Because that would really, kind of gel it all together at that neighbourhood primary care network footprint and geography. And if you needed any linking in, they are happy to help you with that.
Thank you. We haven't yet, but having the link to be able to establish that and really give them an overview of what we're trying to achieve and start forming some of those relationships would be fantastic.
I'll email you afterwards.
Thank you.
Thanks, Chair. Thanks for that report. It was really interesting reading. It was one of those I really wanted to read it cover to cover. You mentioned within it the 6-hour counselling, 6 hours of counselling. Does this include, or is the work separate too for young carers? So that was what just leapt out at me when I read the counselling bit. But also my second part is that during the middle of last year we developed a young health watch. And that's where some of this young carer stuff came out. So I was wondering whether we could link that up somehow into the work that you're doing. Thank you.
Thank you. Again, that would be great to link that to it. The counselling that's referred to in this report is delivered by employees for the response service employed by the council. This was an initiative that started in South Wirral, which was actually funded initially by elected members. It's been really successful, and we wanted to roll it out and include it across the different neighbourhoods, but it's the response counselling service that provide that. But the link to the young carers and the young health watch would be fantastic. Thank you.
So in the context of this being Learning Disability Awareness Week, and the focus in Learning Disability Awareness Week this week is on creativity in the arts, would you be able to expand a bit more on the youth offer that's in here around young people with learning disability and autism, or just with special educational needs and disabilities generally? I know there's a strong offer here, but I just wonder, now's the opportunity during this week to perhaps share a bit more around it if you can.
Yes, of course. In the context of the universal offer, which is what this report relates to, you'll see that we are entering into an arrangement with the Hive, who you'll know have their Hive ability sessions, to try and make the mainstream provision accessible to young people with SEND or disabilities, learning difficulties. So that's going to be a particular focus for the next 12 months. Separate to the universal offer, you'll know that we have the Creative Arts Centre at Pilgrim Street, where we have our SEND youth voice group and a lot of our SEND activities, which are aligned to this and, of course, accessible to all.
Thank you, Chair. The committee last night was really delighted to receive this and be able to impel it on its next stage of its fairly lengthy journey. Pleased to be able to see the council investing in our young people and in a universal offer which is open to any young person. I guess as the chair of that committee, I feel it's my job to speak up for young people, and it's been a terrible time to be a young person or a teenager. It's not been great for any of us, but who of us would have liked to have our freedom and our opportunities so curtailed at that rather tender age? And I'm really glad that there are going to be opportunities going forward that will give them an opportunity to socialise, to mix, to get all those other benefits that are laid out in this report. So thank you very much.
Any further comments? Councillor Gilchrist.
I think the key is that this service should be sustainable going forward. The youth service over many years was somewhat squeezed and became, I'll say at worst, a shadow of itself in some areas, but I'm hopeful that the budget that the council passed this year will bring some stability into the service, especially when there's a pool of people that can be available so that premises or services don't close at short notice. And that's one of the reassurances that I get from the report, that we're now looking to a service that we can be happy to see going on into the future and developing further.
Thank you. Well, in the absence of any other comments or questions, it just leaves me to thank you very, very much, Elizabeth, for presenting those reports and for preparing them and for the team who I know have worked behind the preparation of the report. So thank you again very much. And the board will obviously look forward to seeing updates on progress over a period of time. So thank you very much for that. Then we're now moving on to tackling health inequalities through regeneration, which is Rachel's.
Thank you, Chair. So this report, which has been compiled with colleagues from Alan Evans' directorate, is presented for information to the board today, and it has been previously to the Adult Social Care and Public Health Committee. And really it outlines the investment within the council around health-related worklessness and our intentions really to support not just health outcomes and improve those, but also social and economic outcomes as well. We've talked quite a bit today, I think, about how the economic conditions of somebody's life really play out in terms of their health outcomes. So this is a fundamental piece of work around tackling those wider determinants of health that have a real impact on the health of our residents and how that affects our health inequalities right across the borough. We know, and I think everyone on this committee will be very aware, that health and wealth go hand in glove, really, and I think the pandemic, probably more than anything else in recent times, has illustrated the impact of that and what that means. So for some years, I think it's fair to say, public health partners alongside colleagues with others in the council have really been trying to look at the issue of health-related worklessness. So we know for some of our communities, unemployment and long-term health issues preventing employment have been long-standing challenges in our communities. And actually, what we set out to do was develop programmes which should support and enable people to get back into work and maximise their incomes. So this report really sets out those activities that we've been undertaking for a number of years now, funded from a combination of the public health grant and some external funding also. This programme of work will become increasingly important as I think, as the paper outlines, we've seen that unemployment has become an ever increasing issue in our borough as a result of the pandemic. The work that happens through both of these schemes of work is really targeted in communities where we know there are some challenges, and I think there will also be emerging challenges in other communities as the impact of the pandemic develops over time. You can see the two programmes that are described, and I know that many of you in the room will be familiar with those. So the Connectors programme is, or more sort of better known, I suppose, the Community Connectors have now been operating for a number of years across Wirral and have really shifted after we listened to what residents said about the things that would help them to improve their health, to really addressing the issues that affect people's lives, dealing with the symptoms rather than the causes. So that's really the premise of that programme. And similarly, the Reach Out programme, Wirral Ways to Work, is there to support and enable people to get back into employment. Sometimes people who really haven't been in the workforce for a very long time, or perhaps may never have been at all. Finally, just to say that colleagues across the council are now looking at how we develop and sustain these services beyond the external investment that's secured. So we wanted to cite this committee on that work and make sure that we bring back updates to this group in terms of how that develops over time. Happy to take any questions if there are any on this report.
Thank you. Thank you very much for that report, Rachel. And I think, like other reports that have come, one of the things that certainly strikes me is we need to look at how that spreads across the whole system. I think that's important, that this board is the place where we can do that, where we can look at that. I've got Councillor Gilchrist and Councillor Williamson and the Director of Public Health.
Thank you, Chair. I'm particularly interested to know about future sustainability of income for some of the organisations, especially the sums available to the Reach Out team, because whilst the European Social Fund is mentioned, I have an idea that the government promised that there would be some funds to replace that would appear hopefully in time, so that uncertainty is removed, and it's possible that Janet on the City Region is more up to date with what's being promised for the future. But I think we need to be alerted if there are any particular difficulties that would mean that the Reach Out service, even though we're looking a year and a quarter ahead now, we would want to avoid the loss of committed people working for it and the loss of the work that it does. So I'm hopeful that there's some planning ahead for that and some lobbying to make sure that those kinds of funds do become available to us through the region or other sources. Thank you.
Thank you, Chair. And thank you for this report. And, you know, I have worked with you previously, and I really remember the time in public health and working with yourself and Julie very, very fondly. Again, this is exactly what we need, isn't it? Alan's heard me say this a million times, and I've become a bit of a robot in this respect. But regeneration, if its only purpose is to deliver profits for a company and no other benefits to the community, then it's not achieved what it should do. So the fact that we're using our regeneration programs to benefit our communities and those that need our help the most is brilliant. Some of the stats that you included are of real concern. So out of the just over 31,000 people on universal credit, over a third of those people are working, which means there's substantial in-work poverty, and that's counter to the line that we keep hearing about. You know, you work your way out of poverty. Quite clearly, that's not the case, and that is a real big issue for us. We have to have people in meaningful employment and in well-paid employment. So that's a statistic that really concerned me. And also, I've seen that of all the SA claimants that have been on the benefit for over 2 years, over half of them are on that benefit because of mental health issues. Again, that's another real concern for us. And I can't see that figure improving post-COVID with everything that COVID has brought on a physical and a mental level. And also the mortality rate from COVID is twice that for people in the poorest parts of the borough, which I think if any statistic highlighted just how inequalities have been flushed out and worsened by COVID, then that's the one. So for me, this absolutely validates everything that this board, this committee is here for. And they are some really stark statistics. So I just want to say, and also when a claimant moves into a job that pays the living wage, which as a living wage council, I'm really proud that we are, the benefits are actually tangible and measurable. So it puts back into the economy £13,000 and it gives the claimant over £6,000 and it saves the government money too. So there's some real hard statistics here that make the case to treat people fairly with decent jobs, and that from there which they will grow and their mental and physical well-being will improve. So thank you once again for this really, really important, and Chair, this is really great stuff. Thanks.
Yeah, I couldn't agree more with those points. Councillor Williamson. Julie.
Thanks, Chair. I think I can speak on behalf of Rachel and I that this has been one of the best pieces of work that we've done since we've moved across from the NHS into the council and working with Alan's team. When we first started, I thought, well, there's not going to be a lot that we can actually connect together around this because we were coming at it from such different angles. But actually, I think we've got a really strong working relationship now with the Regen team. I'd like to see that this becomes a regular report coming into the Health and Wellbeing Board, and actually we start to see that list of, hopefully they won't be projects, they'll actually move into mainstream work, but we start to really put the rhetoric into action, and you start to see that start to be delivered through the Regen programme, through the community wealth building programme, and I think also through the ask of our NHS colleagues around their Anchor Institute status as well within the borough, because Karen, you mentioned before, and we know NHS in this borough is a major employer, so there's lots of work we can do there. And I think the aspiration for our children and young people, because of the pandemic, seeing the NHS particularly and other public sector organisations as a way of, you know, that career path and into very, well, I believe, really rewarding public service jobs. So I think there's a massive agenda here for us all to work on together, and I'd like to see that this report starts to come on a probably 6-monthly basis so that we can continue to make sure that debate continues going forward. Thank you.
Thank you. Yes, I'm sure that we can arrange for that to that to happen, Julie, and I think you're right, it is an absolutely essential component of what this board is for and what it's about. One of the things that Councillor Williamson raised is again that absolutely frightening statistic about the level of in-work poverty that we see when you look at the number of people claiming benefit who are actually working in Wirral. That's apart from those people who are unemployed and claiming benefit. And one of the things I'm aware that your committee, Councillor Clements last night agreed to do was to look at the child poverty strategy. And I would suggest that we work together, because I think this board needs to look at an overall poverty strategy for the whole of Wirral. Because I do think that there are huge issues with poverty, not just in terms of social and economic issues, but issues that affect whole communities, because we know the things that arise from that poverty, not just physical health problems, mental health problems, long-term conditions, antisocial behaviour, all kinds of issues, young people becoming involved in the criminal justice system, all arising with their roots very firmly sat in poverty. And as a board, I think we are well placed to work together as a system to look at a comprehensive anti-poverty strategy for the whole system right across Wirral. So I would urge that we look to work together with our colleagues from, I know from Children's, who agreed to look at that in respect of children and young people. I think if we can broaden that to a council-wide anti-poverty strategy, well, to a system-wide anti-poverty strategy, I think that would be really useful. So thank you again for that report, Rachel. That was excellent. And now somebody's going to tell me whether we've reached the
Thank you, Chair. Members, this will be a standing item on the agenda moving forward. The purpose of the report is to provide the board with foresight of the planned agenda items for future meetings. and to give members an opportunity to propose additional items for consideration by the board. So the work programme itself is detailed at Appendix 1 to the report. The work programme is still in its infancy as the Health and Wellbeing Board relaunches following the pandemic. So therefore, partners around the table are asked to propose items for future consideration by the board. The programme itself also details the work that's ongoing outside of board meetings, such as the work on the relationship with the community, voluntary and faith sector, which I'm sure there may be further updates on. So the board is asked to note the current work programme as detailed at Appendix 1, but also suggest further items for inclusion, and also agree if there are any standing items the board feels are required at every meeting. Thank you, Chair.
Thank you very much, Dan. I'm aware that we asked Community Voice to organise a community voluntary and faith sector reference group and working group, and I do know that that's happened and that they've met and that there have been a couple of reports produced. Do we have anyone here who's able to present those reports?
I can't see anybody here, Chair, but we have received those reports if you want us to circulate those to the board.
If you could circulate those to members. What I am aware of from reading the reports is that over 50 community, voluntary and faith organisations expressed an interest to be involved in a reference group to feed into this board, because if you recall, we agreed that we'd do a reference group because it was not possible. The breadth of the sector made it completely impossible to have one representative on the board. So there were over 50 organisations who were very happy and welcomed the opportunity to share in the work of the Health and Wellbeing Board. There's a request that I go along and talk about the work of the board and what we're doing, which I'm very, very happy to do. And they're going to meet regularly and provide regular reports and updates for this group, and we'll respond to any requests from the board about particular areas on which we want feedback from the third sector. So I'm really pleased that that's got off the ground, and I'm absolutely delighted at the level of interest that there's been in working alongside the board. I'm really pleased that so many organisations wanted to contribute and wanted to support the work that we're doing. So I look forward to hearing more about that. Right, anything else on the work programme? Anything people want to see that you haven't, that isn't in there, that you think would be valuable and important? Anything? Councillor Gilchrist.
Perhaps many things will flow out of the Public Health Annual Report when Julie presents it to us, but I'm wondering if it's appropriate for us to have an overview as to how our local health services are restoring and recovering services after the pandemic. Well, I'd happily leave it to officers to come forward with areas they think we should be acquainted with. But as I mentioned earlier, I'm sure that all health sectors now got advice since the summer about trying to catch up in inverted commas and deal with the waiting lists and the backlog. And in the same way, the doctors' surgeries had advice about, not that they weren't available separately, but to make themselves available and knowingly available would be put in inverted commas. Seeing how things are going back to what might have been called the new normal, but see how things are progressing as we emerge, hopefully, from the last year of terrible troubles.
Following that, Councillor Gilchrist, is probably, I think, 3 or 4 areas you might want to see that enter. The restoration of elective services, so that's the provision of operations, day case procedures and so on from the hospital trust, but also how then they're embedding within that new approaches to managing people, including patient-initiated follow-ups, advice and guidance. I think from the community trust as the restoration of community services and the challenge that presents as well, because they play an integral part in keeping people in their own homes, but also managing discharges and providing intermediate care. And I think, again, COVID taught us some lessons about how that can be managed and how we're applying that going forward. The third area is how mental health services are responding, because mental health services have been under some pressure recently in terms of inpatient beds. But again, it's how those services are getting upstream in terms of prevention, promotion, and other services. So, as an example, the work we've done around learning disability services within Wirral and across Cheshire and Merseyside is reducing inpatient bed numbers because there's community alternatives in place. So I think they're probably, and then the fourth area which keeps coming up is how does primary care play its role within this as the service that sees 90% of activity in the NHS every day, and has restored itself, continued to stay open during COVID but in a different form, but is now restoring different ways of working. And so there's probably four areas over the next year you might want to look at and hear more about, and from each of those sectors, what they're actually doing. And I think that would also highlight the connectivity between each of those four areas as well.
Excuse me, I'm sorry, Chair. I'd be happy to bring some of the trends and themes that are emerging from the feedback centre on a quarterly basis, because that would be sort of triangulate that information, I suppose.
I think that would be really, really helpful, because remind me again about the numbers that you've got in terms of feedback. It's huge, I know.
Well, there's 28,000 on there at the moment, but we've got another 18,000 to upload.
I can't do those sums, but it's a lot. That's an awful lot of feedback. I'm sure that comes to over 50,000 feedback comments, so yeah. So we can all probably learn an awful lot from that, so that would be very helpful. Thank you. Any other? Dr. Cowan.
I think it's really important to look at what Councillor Gilchrist is asking about, the restoration of services. But I think what is really useful as well to look at how we're embedding the lessons that we've learned from the last 18 months into how not only we're restoring services, but how we're looking to develop services going forward. And there's been a lot of mixed press around how services have been delivered through the pandemic, both from a primary care, community, secondary care point of view. But actually, there's some really positives that have come out of that, because I know from a clinical point of view, a lot of residents, a lot of patients are happy with remote consultation. A lot aren't. And it's about how we look at a hybrid model as we move forward. So how we learn the lessons of the pandemic, that one shoe doesn't fit all. And I chair the digital poverty group, the digital enablement and choice group, around not everybody has access to an iPad or an iPhone, so not everybody can engage in data platform consultations. So how are we looking at moving forward into our new normal and our new world, recognizing the abilities, the capabilities and the connectivity of all of our residents and how they can be accommodated as we move forward. So I think part of what Councillor Gilchrist says around how we're restoring, but it's also about what are we doing about the lessons that we've learned through the last 18 months and how are we implementing that and working with our residents and working with Karen in Health Watch and taking that feedback on board and not being offended by the feedback. In fact, turning it around and using it as a positive and saying, actually, this is what's been fed back. Let's look at how we can do things differently and how we can use that going forward.
Yeah, thank you very much. That's helpful. I think, so what a slight change then suggested to what you wanted, Phil. So we're looking at restoration and development. of services? Yeah, okay. So we'll put that on the work programme going forward. And if you could put the Health Watch feedback as a regular item, please, Dan, on that. Anything else? Any other suggestions? Anything else people want to see? This is not your only chance. By all means, at any point or at any future meetings, we can update. Right, so if there is nothing further, no further items, can I thank all of you very much? Well, it was spectacular. Can I thank you all very much for coming this afternoon and for all of your contributions? Can I particularly thank those who presented reports and put the work into producing those reports, because they've been absolutely excellent and totally focused around the work of this board. And I think it's perhaps helped us all to put into a context of the sort of work that we need to do going forward. So thank you all very much for that. Hope you found it a productive hour and a half, hour and 3/4, and look forward to seeing you all in July. Thank you all very much.